I'm Benoit Peyronnet. I'm a French urologist working in University of Rennes, and my practice and my area of expertise, I would say, are really focused on all pelvic perineology, functional urology, neurourology, and so the very topics that are at the heart of the ICS. I'll be taking part to the workshop on robotic functional urology, so it's actually a real story because the journey started 2 years ago. We did the first workshop in Madrid, and it was really about setting up a robotic functional urology and pelvic perineology program. And since then, things have moved on. We did create the committee of robotic surgery of the ICS. And so this year we are very excited to have this workshop, and I will chair that with Michel Windel. We'll have fantastic faculty, urologists, gynecologists, and we'll go very much into the details of each procedures, which was really not the point of the first workshop we did 2 years ago. This time we really want to go into the technique and the training pathway and all those stuff. So we expect to have a much more detailed overview of all you can do in robotic surgery in our field, I would say. Robotic surgery has been gaining momentum more and more, and now we can clearly see that it's really there at the ICS. And I think we do have now robotic surgeons involved in our field, and that's really exciting. I think it's still only growing, and we'll keep having more and more sessions on those topics every year, but this year is really a special year for us in Maastricht. As a young trainee, you look up to the ICS for answers to your daily practice questions. And the annual meeting, of course, is really the heart of this, like really the moment in every year where internationally we can gather all together in one place for a couple of days, going over all the really practical questions that we have all over the year, and of course all the research questions. So it's a fantastic event to learn, but also to meet people from all over the world who are dealing with the same kind of issues that you are dealing at your place, and very, very nice networking and socializing event. You really get the opportunity. So that's one of the beauty of the ICS. Is compared to other international meetings, it's big enough but not too big so that you can really have interaction with a lot of people there. One of the things that I like the most is always a multidisciplinary aspect in the ICS. Exchanging views with someone from another specialty, they always have a different vision from ours, and you do learn sometimes much more than talking to your peers from your own specialty who we have most of the time common views on similar problems. So that's all those opportunities that I'm really looking forward to finding again at the ICS this year. Maastricht is really an historical place for pelvic perineology, functional urology, neurourology, the place of many innovations, many pioneering works, great expertise of the several teams involved in pelvic floor medicine, I would say, and so being where all of these things happen in the heart of Europe, I think I've never been to Maastricht, to be honest, but the city seems very nice and exactly as ICS, not too small, not too big, so that we can be all together and enjoying ourselves. And so, yeah, I think it's gonna be a great meeting again.